Hello there, everyone. Welcome. Thank you all for being here today for our March Dementia Friendly Nevada Distinguished Speaker Series. It's such a pleasure to have you all here. And we are and at the right time, since our time jumped ahead an hour yesterday. We are it's starting to feel like summer, isn't it? With the time changing. I saw some trees budding in Reno, and it's an exciting time. So welcome everyone. For anyone I have not had the opportunity to meet, it's a pleasure. My name is Casey Venturini, and I serve as director of the statewide Dementia Friendly Nevada initiative. In my role as assistant director with a program at the University of Nevada, Reno called the DEER program. DEER stands for Dementia Engagement, Education, and Research Program. And we serve as the institutional home base of Dementia Friendly Nevada. And one of the things that we do on a monthly basis is convene this distinguished speaker series as an opportunity to bring the best of the best, the experts, to Nevada, at least virtually. And we see this space as providing education and information that can then be utilized by the network of community groups that comprise Dementia Friendly Nevada. If you're joining us from outside of Nevada, then you might not know that we have 9 communities across the state that are working to become more respectful, educated, supportive, and inclusive of people living with dementia and care partners. And doing so incredibly successfully. I see some of the co-facilitators of those groups on this call today. Those are the local leaders who really champion that work. Dementia Friendly Nevada would not happen without their dedicated support. I see Ginny Cunningham from Winnemucca. I see Sarah Viles from Story County. And I see Kayla Osler, who used to be our co-facilitator with Dementia Friendly Elko County. So just a tremendous thank you to everyone who has been part of those community groups, and certainly to our co-facilitators who lead them. But if you are not from Nevada, know that this information that we cover here is just as useful and important outside of our great state as it is inside of Nevada. So you'll be an honorary Nevadan today, and I hope you keep coming back. Well, without further ado, I want to introduce our distinguished speaker for today, and that is Lori Smetanka. And Lori is the Executive Director of the National Consumer Voice for Quality Long-Term Care, which is the leading national nonprofit advocacy organization representing consumers receiving long-term care and services in nursing homes, in assisted living communities, and in home and community-based settings. As executive director, Lori oversees and contributes to the organization's policy, advocacy, program activities, leads the organization's fundraising efforts, establishes strategic partnerships with other organizations and federal agencies working on issues related to the provision of long-term services and supports. And she also establishes the strategic direction for Consumer Voice. From 2004 to 2016, Lori served as director of the National Long-Term Care Ombudsman Resource Center, or NORC. You're familiar with the Ombudsman program because we had Nevada's state long-term care ombudsman, Mariko, join us for our distinguished speaker last month. And in that role with NORC, Lori provided technical assistance, training, and support to the 53 state ombudsmen and the statewide networks across the country. Prior to that role, Lori served as law and policy specialist at Consumer Voice, where she provided policy analysis, consultation, education, technical assistance, and training on long-term care issues. She has a Bachelor of Arts from Indiana University of Pennsylvania and a JD from the University of Dayton School of Law. Lori uh, Lori, we are so privileged to have you with us. Thank you for being our distinguished speaker today. I'll go ahead and hand the virtual mic over to you.
Great. Thank you so much, Casey, for inviting me to be with you today. And hi, everyone. I'm really delighted to be here. I'm going to bring up some slides for right now that I'm going to share to lead us through my presentation. I will be sharing the slides with Casey and the team when we're through, and he will make them available to all of you who are participating so that you can have them if you'd like as a resource. So But I'm really delighted to be with all of you today and actually see a couple names on here that I recognize. So it's really nice to be with you all. So let's get started. For those of you who are not familiar with the Consumer Voice, as Casey mentioned, we're a national nonprofit advocacy organization. We work with and on behalf of people who receive long-term care and services it in primarily in residential long-term care. That's where our primary focus of work is, but we have for the last number of years been working to expand our advocacy to people who are also receiving care and services in home and community-based settings. And we do our work in a number of different ways. Importantly, we advocate for public policies that support quality care and quality of life that's responsive to consumers' needs. That's really our focus, is that the individuals receiving care receive quality care and services, not just the fact that services are being provided. We work to educate and empower consumers and families with information that they need to self-advocate, and to give them the resources to know what they should expect with long-term care and tools to know how they can advocate. We have an advocacy center on our website, for example, that helps guide people through how they can be part of their own advocacy network and work to improve conditions for themselves and their loved ones. We also work to train and support individuals and groups that advocate on behalf of people receiving long-term care and services. So, for example, the Long-Term Care Ombudsman Program are a key constituent of ours, and through our office, we house and operate the National Long-Term Care Ombudsman Resource Center, which is a federally funded grant, and we work to support, train, and provide technical assistance to ombudsmen across the country to support their work on behalf of individuals receiving services. And a big area of focus for our work is related to promoting the critical role of staffing, direct care workforce, and best practices in long-term care facilities. Because what we really have found is that without having adequate staff who are trained properly and have proper oversight, we really are not going to achieve quality long-term care. And that's been a big issue for people receiving services today. So today we're going to be talking about residence rights for individuals living in residential long-term care settings and how we can uphold those rights. And when I talk about residential long-term care and services, what I'm talking really about are nursing homes, assisted living, boarding care facilities, personal care homes. Nursing homes are, consistently labeled throughout the country. Assisted living has different names throughout the country, depending on where you live and how it's structured in your state. So that's why you see a number of different names here. But certainly, we are talking about congregate care settings, residential care settings where people are living to receive care and services. I think an important thing to remember first is that regardless of where you live, whether you're living in your own home, whether you're in a congregate care setting, in a residential care facility, people do not lose their personal and civil rights when they are, no matter what their setting is. You still have your full access to your full civil and human rights as you did when you were living at home, as all of us do today. And unfortunately, too often we think about people living in residential care settings as other and who who may not still have those rights. And that's not true. You still, have all of those full civil and human rights, and they should be enforced on your behalf. But people who live in long-term care facilities or residential care settings also have additional rights that have been provided to them by state and federal laws, and I'll talk about them in just a minute. But there are additional rights because of where they live and because they're in a different situation and dependent upon others to receive their care. Additional rights through state and federal laws have been established in order to, again, help them achieve quality care and to ensure that their full personal and civil rights are continued to be respected. When we talk about rights, we really need to think about them as the foundation of quality of life. That's really integral to, when a person's rights are respected, that goes a long way to supporting them having quality of life. And, think of it all as integral. They're inextricably linked together. so that when we're thinking about a person's quality of life, it really is important to think about thinking about it kind of in a bigger way. And when we think about rights and quality of life, upholding an individual person's rights improves outcomes, generally speaking. It improves quality of life. It often improves quality care outcomes, and can reduce harm for that individual. And when we think about quality of life and quality of care, residents' rights for individuals, and that connection that occurs between them, that's something that we hear a lot about when we talk to residents of long-term care facilities. And in fact, that connection between that implementation of rights and quality was really evident in some responses that we received in a survey that we did last year. We had put out an informal survey, and we had more than 450 residents of nursing homes and assisted living facilities respond to the survey, and we asked various questions related to their daily life and experiences living in a residential care setting, such as relating to what their quality of life was like, the care that they received, what did they think about the food they were being served, and the activities that were being offered to them? Did they have access to loved ones and visitors or interaction with the community? So there were a whole range of things that we talked about, and we were really thrilled with the results. Previous surveys, it's often difficult to reach individuals living in residential care settings, particularly if you're just putting something out through e-blasts or webinars or social media, but we were able to get a really robust response, and we got not only good quantitative data and information from this informal survey that we did, but really terrific qualitative data as well, where people provided a lot of comments about what their experiences were like. And the results were very telling. A full 50% of respondents said that their quality of life had declined after moving in to a long-term care facility or a residential care setting. Some of that was due to facility practices, like not having enough staff, for example, or staff not being well trained, not offering engaging activities. The food wasn't as good as they would have liked. But what was really, telling for us was that some of the responses that we were getting also were really tied to individual rights not being respected and enforced as they should have been, such as whether or not the person was being treated with dignity and respect, and how often they were being treated with dignity and respect, whether or not their opinions and preferences were taken into account in terms of setting their schedule for the day or in terms of developing their care plan, the medical treatments that they were being provided, and taking all of that into account as care and treatment was being taken and provided for them. And so, that really, showed us again and reinforced the fact that, when we're talking about quality, you really cannot extricate, quality of life and quality of care and residents' rights and think about them in individual buckets, because there is, so much interaction between them. In the comments that residents provided, many of them wrote about how their preferences and wishes were not being followed consistently, that they really were having to just give up their own preferences and accept the schedules that were being dictated to them by the staff, by the facility, that things that were important to them were not either being honored or they were not being assisted in accessing religious services, for example, or different activities that were meaningful for them, or the ability to leave the residential care setting and interact more with people in the community. So, it's really when we're thinking about, how we can support individuals, we need to be thinking about not just what kind of care, like technical care, clinical care that we're providing to an individual, but how are we supporting them holistically and supporting their quality of life and supporting and ensuring that they are being given an opportunity to grow. So many residents that we talk with invariably talk about the importance of being treated with dignity and respect. That's one of the first things that they'll talk about when we say, what could make things better for you in a long-term care setting or in a residential setting. How could your life be improved. And almost always they start with they want staff and others to treat them the same as the staff or the other person would want to be treated. The golden rule, right? They want to be treated the same way as anyone else would want to be treated. And so, thinking about, as people who are providing care for individuals who are living in residential settings. We understand that in many cases they are short-staffed, that the staff have not been adequately trained, and that people are moving quickly from one task, to another. But we're dealing with human beings. We're dealing with people who have histories and feelings and preferences and choices the same way we do. And you need to think about, how would I feel if I were in this setting and told, I can't get up in the morning when I want to because there aren't people to get me out of bed, or the kitchen doesn't open until a certain time, and so you can't have that first cup of coffee in the morning, or you can't go to dinner with your loved ones because there's no one to help you get ready to go. There are a lot of things that we take for granted when we're independent and living in our own homes, that you have to think, how can we help support people who are living in residential care settings to have those similar experiences and continue to exercise their independence and their choice, and exercise things that are very important to them. So, when we talk about residence rights, I mentioned earlier that people living in residential care settings often are provided additional rights to those that we all have when we're, living in the community and living in our own homes. And again, that is because it's been a means to have a way to protect rights of individuals, to enforce those rights, to be sure that they actually are being implemented, and it's a mechanism to do that. When we talk about nursing homes are subjected to both federal and uh, state rights that are included in federal and state laws and regulations, most notably the Nursing Home Reform Act of 1987, and then the subsequent requirements that are issued based on their participation in the Medicare and Medicaid programs, and that those are governed by the Centers for Medicare and Medicaid Services. Um, Other settings like assisted living, boarding care, personal care homes, they are subject to state rules and laws, not federal rules and laws. So it really is important that you become familiar with any rules and laws that are governing the setting in which you are living or that your loved one is living. Become familiar with those so that you're really aware of what your expectations, should be, and understand what you can be advocating for, and how to advocate, in order to better protect residents with those rights. It really is important that, again, residents retain all rights unless there's a specific limitation on those. And for example, if a person is under guardianship, for example, because maybe they've been determined to not have capacity to make certain decisions for themselves, then those individuals may have some of their rights restricted in terms of what they may be able to do. But even then, even if a person is under guardianship or has some rights restricted, it is still important to see how can you best allow them to be as participatory as possible and make as many decisions as possible that govern their own lives and experiences. How can we keep them engaged? How can we ensure that their preferences are continuing to be honored to the greatest extent possible? And that is something that we really do need to be thinking about. So I'm going to go through a number of different rights to just kind of focus us in on them. And I'm going to be talking about nursing home residents' rights. It's the area that we work most commonly in. Again, it's their rights that are consistent across the country because they are federal in nature. There are some differences when you look at state-specific rights, and so we're not going to go into those today. But again, it is important that you are aware of, does your state either offer additional rights that go beyond the federal rights, or are they different from what has been provided for those living in assisted living board and care or personal care homes. But a lot of information on rights we have available on our website at the Consumer Voice, which is www.theconsumervoice.org. And there's a slide at the end where you can access some of the information. But when you think about rights, we've kind of broken them up into a variety of buckets that you'll see here. And so I'm going to talk about some of those things going through. So again, when I mentioned that we talk with residents quite a bit, and some of the very first things that they say to us is they want to be treated with respect and dignity. That is their right to be respected with to be treated with respect and dignity, to have their individuality recognized, to be treated with person-centered care. That means that the resident really should be directing what's most important to them. And the caregiver really should be looking at how to best incorporate or allow the resident to engage in different activities that are most important to them, or be cared for in a manner that is most important to them, or to engage with people that are most important to them, really looking at what is most important to that person, getting to know that person best. And so how can you really enhance their experience and enhance their quality of life while you're providing quality care to them? So person-centered care is something that we hear a lot about through different educational programs. It's really become a bigger and bigger cornerstone of the requirements that have been dictated through rights and through federal law and regulation. So, really thinking about, what is it about that person that we can be focusing on to really enhance and encourage them to have the services that are most important to them, and to engage in things that are most important to them. So, that really goes to, like, what time do you like to get up in the morning, for example? Or, are you a morning shower or an evening shower? Do you like to, just lay in bed on a weekend, morning, and drink your coffee and not have to get up and go to breakfast? Are there certain activities that you like to participate in, and how can you best engage with those activities? So, like, what makes life meaningful for you? And those are the types of things that we should really be looking at. And just to kind of spend a little bit more time on a person's individuality and person-centered care, by really getting to know the person, not only and by working to provide the care and services and experiences that are most meaningful to that person, not only can you enhance their quality of life, but you also generally are providing better care to that individual. Like, if a person likes to shower in the evenings versus the morning. They like to have their hair combed a certain way. They like to put on certain clothes after they've been showered. If you're following their directions and instructions, and providing care and services that are most important to them, that gives them a better experience. And oftentimes, it's a matter of providing better care to them also. We see that on a regular basis. And so, it really is important to be thinking about that. Keeping a dignified existence also means protecting a person from abuse, from neglect, from restraints, including chemical restraints. Too often we see that when there's short staff, or particularly with people with dementia, where staff may not understand the communication that a person with dementia is providing to them, and are unable, and are not really recognizing the needs that individual is having. We're seeing too often chemical restraints in the point of antipsychotic drugs are being prescribed for that individual, which really can have a detrimental effect not only on their quality of life, but on their physical and emotional and mental well-being. And so, having a dignified existence means, not being restrained, not being abused or neglected, being able to exercise your rights without being afraid that you're going to be discriminated against, or that you're going to face reprisal or being interfered with. being able to use your personal belongings. When you have a room or a shared room in a residential care setting, you feel more comfortable if you can have pictures on your walls of, friends or loved ones or things that are important to you, using, your own blankets from home or furniture, for example, or, things that are important to you. Really being able to set up your space like you're living at home. Absolutely. Absolutely. I mean, I think, certainly people who live in a congregate care setting have the expectation that they are going to be kept safe from harm to the greatest extent possible. But that doesn't mean that people should not have an opportunity to experience some risk and make some decisions for themselves. None of us make good decisions all the time. There does have to be that balance. When a person does something that you don't think is a good idea, how can you best structure that interaction with them so that they are being able to express themselves, they're being able to experience whatever it is that they're wanting to experience, with doing everything you possibly can in the meantime to keep them safe. So without stifling that experience for them. So, I think that definitely it is important. I mean, when you look at how we raise children, and you have to let them experience different and new things, and you provide as much security around them as possible. The same, with all of us. We all need to be given that opportunity to experience certain things. So I hope that helps answer a question. As we move on to another important area, or buckets of rights that are provided to individuals. And let me also say that when I started with nursing home rights, not only are they federal and they exist across the spectrum, of all nursing homes in the country have to abide by the federal rules if they're certified for Medicare and Medicaid, but they're also the basis for which we see many rights, state rights, for nursing homes or other settings. Many of them are based off of what we see in nursing home rules. And so, these are things that we should be really aspiring to, regardless of the care setting. Because frankly, as you look at them, as we go through all of them, which ones would you take away just because you live in a different setting? I mean, there aren't many that I would take away just because I live in a personal care home, for example, or, an assisted living facility. I mean, I think I would want all of these rights regardless of where it is that I'm living. But another bucket, or area of rights that we look to is the right of self-determination. And again, that really goes back to being able to direct your day, your schedule, make choices on behalf of what is important to you. What kind of care and treatment do you want? You have the right to refuse different kinds of treatment, for example. Having reasonable accommodations of your needs and preferences. Looking at ensuring that your care plan is person-centered, that the resident or the individual receiving services is involved and directing to the extent possible the development of that plan of care and not having it dictated to them by the staff. Too often we hear about care plan meetings that are, every 15 minutes. The resident doesn't even know they're happening. They're not even given time to think about it. They're brought in, the staff go over it with them and say, here's what we want to do for you. What do you think? Sign it. And you're out the door in 15 minutes. That is not comprehensive care planning. That is not really involving that person in what is most meaningful to them and ensuring that the plan of care is really focused on what is most meaningful to them. The right to self-determination also includes the ability to participate in resident and family groups or in other types of organizational groups, in order to connect with other people, both inside and outside of the community. And it's also their right to designate a representative to help them with decision making. Too often there are default people that, facilities look to, that, if they're either not getting the response that they want from an individual receiving services, they may automatically turn, to a family member or someone else to make a decision on behalf of an individual. But, a person receiving services should certainly have as much input into decision making with respect to what's happening to them, for them, on their behalf as possible, and they should also be the ones directing who they want to represent them in the event that they are not able to make decisions or need help making decisions. Being fully informed is another bucket that we look at when we think about residents' rights, and that ranges from the type of care that's being provided to the individual, the risks and benefits of treatments that are being provided, including medications. Too often we see that prescriptions are being written and new medications are showing up in people's medication passes on a regular basis, and they don't know what they're for. You should be told what the medication is for and what the risks and benefits are. Whether there are going to be changes to the plan of care or in your medical status or health status, the individual should be informed of those things. They should be informed in a language or manner in which they understand. If they speak a foreign language, translators should be made available to them. If we have residence rights in multiple languages, for example, on our website, we also have copies available in Braille for people who are blind. But if the individual speaks a different language, they really need to be offered information in a language so that they can understand what is being presented to them. To be fully informed of what their rights and responsibilities are about the ombudsman program and how to contact a long-term care ombudsman should they need their assistance, and also information about the facility. So the facility is surveyed on an annual basis, and the survey reports are publicly available, and they should be available in the facility as well. The right to raise grievances is really important. I mentioned it a little bit before, but individuals, again, when you're talking about rights, should be able to present grievances without discrimination or retaliation within a long-term care facility. They do have the right to prompt efforts to have that grievance to be resolved, and to be able to file a complaint not only within the nursing home or the residential care setting, but also to file complaints with an ombudsman program or with the state survey agency. I know you've had ombudsmen that have presented to your group before, but in fact, as recently as last month, but ombudsmen advocate for individuals in licensed care settings across the spectrum. So in assisted living, in boarding care facilities, in nursing homes, all those residents have access to a long-term care ombudsman. And too often, again, we hear about residents and family members who have raised grievances with a residential care community, and they're not resolved or they're just ignored. But certainly in nursing home rights, you have the right to have efforts to a resolution, and you have the right to have that investigated and a response from the facility. So that is, an important right. Rights to regarding financial affairs is another bucket that we think about in terms of being able to manage your financial affairs and having information about the charges and the services that are being provided to you. This is particularly important if you're in an assisted living or personal care home where you're seeing more a la carte types of expenses. So you have the right to know what's part of your base rate, what charges what you're being charged for, if there are changes in your charges, what the result of that is, and how those decisions are being made. The right to access is another bucket that we see with respect to rights of individuals, and that means right to access to individuals of their choice and preference. And that could be within the long-term care community. It could be to people that are outside of that community. It could be to family members or friends or clergy or whomever is important to that individual. And it means not only right of access to that individual, but it also means the right to refuse visitors. If you're just not feeling up to it that day, you do have the right to say, I'm not really feeling up to visitors today, and please ask them to come back at another time. But access means fully having access to your personal information, to your physician, to people who are advocating on your behalf, again, like the Ombudsman program, the ability to participate in community and religious and social activities that are meaningful for you. And we in that survey that I mentioned, at the very beginning, we talked about residents' access, and we asked about residents' access to communities, to religious activities. And while that's happening in a lot of cases, sometimes what we found in the responses were that depending on what religion you practiced, your access might be greater than someone else's. So many facilities are providing regular and open access to people who might follow a Christian faith, for example. But if you're Muslim or Jewish or Hindu, your access to religious services might be more limited because not as much effort is being put into ensuring that you are having the ability to participate in those types of services. So it's really looking at how can we be advocating for full access to what is important again to that person. Importantly, if a person has sensory impairments, if they need a hearing aid or glasses or some other dentures or some other if they need some assistance in some other way, the facility has a responsibility to help facilitate access to that. And so that really, should be looked at again. I mean, I know that there are real issues with respect to who's paying, for those services. That's something that really should be worked out with the social worker and with the long-term care facility. Call in the ombudsman if you need some assistance in terms of looking at that. But the facility does have a responsibility to making sure that you do have access to the devices that you may need. And the last bucket that I'm going to talk about really is the right to privacy, which is really important, something that we all find very important with respect to our personal lives. And when we talk about right to privacy, really we're looking at personal, financial, medical affairs, being able to talk with a care provider in a private setting, not in the middle of a dining room during lunch, for example, or if a care provider is coming in while your roommate is in the room and wants to talk about important or very personal things, you can ask that you have the ability to talk to them in a private setting. And so you should be able to have that privacy with respect to issues and information that pertains to you. And that also goes for the ability to have private and unrestricted communication with other people. If you have visitors, coming into your residential care home, and when you do have the right to ask for a private place to meet with them, and again, if you're sharing a room with another individual, that may mean that you go to a different room, like a small room or a small corner or someplace else, in the residential care setting, but you do have a right to private and unrestricted communication with others. Your mail shouldn't be opened, your phone calls shouldn't be screened, all of that. And then again, right to privacy during treatment and care of personal needs, ensuring that the curtains are being pulled, and the doors are being closed, and that your dignity again is being respected. When you're being wheeled down the hallway to the shower room, you're fully covered, appropriately covered, and dressed in a way that is most most applicable to how you should be dressed, being rolled down the hallway. So, when we think about, the rights, and again, how important these are for not only all of us in our own personal and daily lives. Again, when you think about like which rights would you give up if if you were rewriting them, we wouldn't give any of them up. So these are, again, I would argue, fundamental rights that we should already be incorporating into the way that we are providing care and services and interacting with people who live in residential care settings. So let's talk about, how we can you know, uphold these rights um, and really look to how we can do things in a residential care setting to honor and enhance and support the rights. What should the residential care setting be doing? And then how can we be advocating for those rights ourselves or on behalf of our loved ones if they are the care recipients? So let's start with how we can really look to focus on enhancing, self-determination. Again, looking at how are we helping the individual express choice and having that choice honored? Whether it is in terms of your daily routine, when you're getting up, when you're going to bed, um, uh, how you're spending your day, so that, we hear a lot about, activities that are being provided and, people just being wheeled down the hall, to activities. Are the residents being asked if they want, to go to that activity? Or are they being asked what activities are being provided? So how can, choices be respected? And raising questions about those things. Looking at how we can respect, again, the cultural or religious or personal identities of the individual. And that really goes back to knowing what is important to that person, and asking them what is important to them and how they want to express those things. So, in terms of, cultural identity, is the person being dressed the way they like with respect to their culture or with respect to their personal identity? We all have different preferences with what that looks like, and so how can we best support an individual? And it really does go back to knowing the person. Here's the risk issue that we had talked about, a little bit before: allowing people to take reasonable risks, but putting the safety nets around them to the greatest extent possible. That doesn't mean that we're always going to, prevent prevent a person from making a bad decision, or from having, something happen, but we're going to do whatever we can to ensure that that person is being able to express themselves to the greatest extent possible. We hear about this a lot when it comes to leaving the residential care setting, a person's ability to come and go as they please, to go outside. We hear about this a lot with respect to locked doors, needing to sign out, having an escort before they leave. And, those are things that we really need to be, looking at. How, a person should not be a prisoner in their residential care setting. They should be able to have access to the outside, and be able to, visit with people, outside. But again, how can we put, safety nets around them so that they are as safe as possible when they are when they're doing things that, may not be things that we would want to do. But again, it really goes back to ensuring that we know the resident, we know what their priorities are, and that we're advocating for that. Whether, we're the resident themselves, the family member, the ombudsman, the staff, how can we really ensure that we are enhancing that individual's self-determination to the greatest extent possible? Supporting relationships is, certainly another area where we think about how can we support and uphold an individual's rights. And a lot of this comes through supporting their meaningful engagement with other people, um, including those that are outside of the facility. And that may include people other than their family. So, if they've been part of church groups, for example, or civics groups, how can we help facilitate those relationships? Um, Even after they're living in the residential care community, ensuring that they have access to visitors at times that are best for the person living in the long-term care facility. We should not really be subjecting, certainly family, to visiting hours, for example. And in a nursing home, you can't put visiting hours for family members or for essential caregivers in place. Uh, because the individual receiving services, the resident, has the right to access family at any time, at a time of their choosing. And so, it's important to look at what makes the most sense. Too often, particularly if a person that is receiving care has some limited capacity or some difficulty making some decisions, we often do find either staff or certain family members who try to restrict access to other visitors, other family members, or other people that may be meaningful to that individual who is living in that residential care setting. And if that person is important to the resident, then we need to figure out a way to foster that relationship. And how can we do that? Just because siblings may be fighting, we should not be taking it out on the parent who may be living in the residential care facility. So, how can we best, foster those relationships with others, and ensure that the person has access to people that are most important to them. And that really goes back to the need to support their engagement, prioritize connection, and really avoid isolating that individual from others. That happens too frequently. Isolation can be deadly for folks. There's a lot of research on that. People living in residential care settings, even with lots of people around them, can become very isolated. And so, how can we really ensure that there is connection and that they're having access to people who are meaningful to them? Um, Another way we really can be promoting and enhancing rights of individuals and quality of life is looking at how we can protect them from harm. And, thinking about having, as a residential care community, there really needs to be zero abuse for abuse, neglect, exploitation, and retaliation. That is a huge one. Too often, if a person either complains or challenges something that's being provided to them, the staff or other people may retaliate against them. And we hear all the time how people can be fearful about raising problems or raising complaints, but there really needs to be a zero tolerance policy among the leadership in that care community against retaliation to ensure that the individual receiving services has the ability to express themselves and to raise issues when they're not right or not appropriate for them. There's a big push to ensure that care practices are trauma informed when they're being provided, so that you're not triggering latent trauma experiences that a person may have experienced at some point in their past. And so staff really should be educated on trauma-informed care to ensure that you're not putting the resident through either mental or psychosocial harm. Staffing is really, really critical in order to ensure that residents' needs are being met. What the nursing home requirements are is that a facility is to have sufficient staff to meet the residents' needs and promote their highest practicable well-being. That's, a really critical thing in terms of getting to quality of life as well as quality of care. And what we have found is some of the best residential care communities have good and transparent communication with residents and families. I always see it as a red flag if they're trying to hide information, from you. The best thing to do is for them to be transparent with communication, and the same with residents and families to be communicating, with the residential care community. But by having that communication, it really fosters more a sense of community and more a sense of partnership in terms of the ability of providing care and ensuring not only the care needs, but protecting the rights and promoting quality of care for individuals. Staffing, as I mentioned very early on today, is a very key issue. We really can't. We're not promoting residents' rights. We're not promoting quality of life, and we're not promoting quality of care if we don't have sufficient staff that are available on site to provide care and services to an individual, that are trained to provide the appropriate care for the population that's living in that residential care community. So, for example, if that community has high numbers of people with Alzheimer's or other forms of dementia, ensuring that the staff are very well trained in how to provide care for people with dementia, ensuring if you have people who have other special needs, that the staff are actually trained to provide care for those individuals and that there are enough staff to provide care for those individuals. That is really key. Consistent assignment means that staff take care of the same residents or the same individuals on a daily basis. So you don't have multiple staff taking care of you, a different staff person every shift every day for perpetuity. By getting to know an individual, by getting to know how they like care provided to them, by getting to know their quirks, getting to know their triggers, getting to know the things that calm them if they are upset or distressed, really helps provide better care for that individual. And that, that is really, really critical. It also helps notice changes in condition. By really getting to know an individual, you'll know, well, they're acting a little bit differently today, or their face is a little bit more flushed than it was yesterday. But a new staff person coming in wouldn't know those things and could miss really important changes in condition where a person might need some additional medical care. But, it goes not only to care, but really to providing person-centered care is by knowing the individual, what their likes and dislikes are. We have a form on our website called My Personal Directions, in fact, where, it's something that as a resident, as an individual going into a residential care community, or even a family member could help fill it out on their behalf. And it asks questions like, what's important to you? How do you like to spend your morning? What's your nighttime routine? What comforts you when you're feeling upset? What makes you upset or angry? And so if you share that information when you're getting to know an individual who's newly living in a residential care community, that can really help you um, get to know better, how they like to be cared for, what their routines would look like. And it really helps better not only protect their rights, but provide that quality of care and provide that individualized care for that individual. Talked to a number of residents who talk about training the new staff they come in terms of how they like to be cared for. And so, that's something that a number of residents do. They'll tell a person, this is how I like to be cared for. This is how I would like you to treat me or take care of me when you are my caregiver for today. And that really helps make things go much more smoothly. And by focusing in on a staff issue, by focusing in on staffing, and this goes to the next point that I'm going to make, we really want to be promoting the resident voice and autonomy, for that individual. How can we really raise the individual voice and ensure that they are directing the care and services that are being provided to them within that facility? And some of the ways, that we can do that include that open communication, include getting ready to talk or facilitating and talking with individuals and getting to know them, when we're starting to care for them as residents of that place. But other ways that we can do that are by ensuring that resident councils are resident led, for example, and that it's not the facility or the residential care community that is leading the resident council, that the council has the ability to have private meetings, that they're inviting guests to participate, that they're setting the agenda, that they're the ones that are really focusing in on what that resident council should be working on. At least in the nursing homes, their role is to support the resident council, to help facilitate and support it, but the residents are the ones who should be directing the work of that council. Open communication and regular communication between residents, families, and administration and staff are really key and critical. That can happen through resident or family council meetings or through maybe town hall type of meetings, in a long-term care facility. During COVID, we saw a lot of really creative ways that administrators we're communicating with families either through Zoom calls or through daily e-blasts that were going out by having a variety of different mechanisms for communicating. And those things hopefully have continued since then and not just have risen up, during the pandemic. But again, by having that regular communication, regular listening session, that really helps to raise the level of care that's being provided and the quality of life for everyone who's in that long-term care facility. I firmly believe that residents and families should be involved in facility operations. And by that, I mean they should be involved in hiring staff. They should be involved in participating in quality assurance committees and really looking at resolving issues or concerns that have been identified in that long-term care facility. They are the recipients of the care and services, and they, I'm sure, have good ideas and good ways and good thoughts for how things can be implemented in order to better facilitate operation of good care practices in that long-term care facility. And they really should be involved in those processes. Um, I know that we hear about involvement in facility operations. A lot of places will involve residents in like food committees or activity setting, and I think that's really important as well. But let's go beyond that in terms of training staff, hiring staff involved in facility operations in order to bring that resident and family voice there. And there are a number of facilities that already do that and do it successfully. Having an accessible and effective grievance process, we talked about grievances a couple slides back. That is a really key way for raising that resident voice and ensuring that the care setting is responsive to the needs of the people that are living and receiving services there. And that's another way that we can be really open in communication and help with problem solving to ensure that all stakeholders are participating in that process. Um, Ensuring that residents have their rights in plain language. Again, there are a number of different mechanisms available for ensuring that a resident or a family are getting information that in a way that they understand it. That should be part of a care setting's policies and procedures in terms of how they're going to ensure that that happens. I mean, sometimes it's using a family member as a translator, but if that's not possible, there are other sources in a community that should be identified, in advance when you know that you have someone who either speaks another language or needs another method of communication, sign language, for example, or Braille, or some other mechanism. And again, empowering residents to speak up without fear of retaliation. This is also where resident councils are really important, and family councils are really important because too often residents may be afraid or individuals may be afraid to raise problems or concerns because they are afraid of retaliation. But by having the resident or family council be a vehicle through which to highlight problems and concerns, that is a way where, number one, you can see, is this an issue that just I'm having, or are other people experiencing it in this community? And it's a way that you can work together to solve a problem that is probably affecting multiple people. We can be enhancing the role of families and essential caregivers in the caregiving process and in supporting residents' rights and quality of life. Remember that families are partners. They are essential caregivers, they are partners. They're more than just visitors. They're more than, like the friend from the neighborhood who stopped by to just, chat for a few minutes. Many family members are key care partners who are providing different kinds of support to that individual living in that residential care setting, particularly if the individual does have cognitive impairment or dementia. Family caregivers are really, really critical for providing supports, communication, assistance, and advocacy on behalf of those individuals. And really looking at how we can support and facilitate family involvement and not restrict that. Um, we want to promote oversight and accountability. This is a really important way to uphold individual rights and quality of life in a long-term care facility. We've talked about ombudsman programs and survey agencies, that respond to complaints, investigate the survey agencies, hold facilities accountable for when they're out of compliance with standards. But there are different other programs that also can provide some supports, like disability rights programs, are also important advocates for people living in residential care settings. We need public reporting of the quality standards in facilities and the staffing standards in facilities. That occurs for nursing homes, but it doesn't always occur for other settings unless a state has established um, has established the public reporting of survey reports, for example, or what staffing looks like in a particular care setting. But by having transparent information of who owns these settings, what's the quality like in the setting, what does staffing look like, have they been subject to fines or any other deficiencies or penalties, really provides good information to the people who are not only living in that residential care setting, but may be looking to move into a residential care setting. And it helps hold them accountable and ideally raises the standard for them. We really want to be promoting a resident-centered culture in residential care settings. So again, we talked about supporting resident decision making, creating an environment that feels like home, giving them the opportunity to exist as if that place, were their home, because it is their home. Most people living in residential care facilities, particularly nursing homes, are there for at least 3 years. Um, and so that becomes their home. They have created community for themselves with the staff and with the other people living there. And so we want them to be as comfortable as possible. We really are looking to build relationships. That's how good care is provided. And that really helps foster the protection of residents' rights and promoting quality of life. And that all needs to be embedded in the policies and practices that exist in that residential care home. And we need to really be looking at, measuring quality in a facility by the quality of life that the people are experiencing there, not just by the clinical care standards that are being provided. It's great to ensure that, as few people as possible fall or have pressure ulcers or have really high care needs, but we want to make sure that they are also experiencing quality of life and not just getting those clinical services. And there are a lot of ways that we can be advocating for people who are living in residential care communities, whether that's ourselves or whether that's our loved ones. We can be again looking at what rights we have in state and federal laws and regulations and advocating to strengthen them if they don't quite meet the standards that we would be hoping for. We can be pushing for greater staffing levels in all of these settings in order to meet the needs of the people that are living in these communities. We want to be increasing transparency of ownership and information so that people can make informed decisions about where they want to be living and spending their time and hard-earned money. And we really want to be elevating resident and family voices in policymaking. That's really, really critical. We encourage people who are living in residential care settings, their family members, their advocates, to really be communicating with policymakers. What is your experience like? Both the good and the bad. They need to know that so that when policies need changing, they are really understanding what's happening in these settings and can make good decisions about how to change those policies. So with that, I'll leave you with information about how to get in touch with our organization. And am happy to answer questions. I can't multitask and look at questions and do slides at the same time, so I wasn't I'm not that skilled. So, but I'm happy to have discussion or answer any questions if folks have some. I would argue that they still retain all of these rights, yes, and we need to be supporting and facilitating their ability to express their rights, express their preferences, and have them honored to the greatest extent possible. Absolutely. Now, if capacity is an issue and they have a legal decision maker who has been provided to them by a court, like a guardian, for example, that doesn't mean that they shouldn't have their daily choices honored, what they like to wear, what they like to eat, when they like to get up. Yeah, I mean, there are certain aspects of our daily lives that are core and fundamental to all of us, and regardless of whether or not you are living with dementia or living in a locked unit, you should not be denied things that are meaningful for you. So, unfortunately, we do not have good staffing standards um, that, at least at the federal level, that are in existence. We had gotten regulations with staffing standards finalized last year, and unfortunately, they've just been rolled back. So, a number of states do have some staffing standards. I think few of them break it out by dementia specific units though. So that is something and I'm sorry, I should have looked that up for Nevada before today, and I just didn't quite think to do that. But that is something that we can be looking at in terms of what Nevada requires for staffing. Many places may have many states have staffing standards for nursing homes. We, as advocates, don't think they're necessarily as robust as they should be. We think that in most states they can be higher. So that is something that we encourage people to be advocating for, is higher staffing standards. And particularly when you have a population of people living with dementia or dementia unit, um, people there certainly they need to be looking at what their care needs are for the numbers of staff that are provided, but also the training that's provided to ensure that they have specialized training. So that's really critical as well. I think the best thing you can do is talk to the people that are receiving services and ask them what's important to them, and then look at how you can help facilitate what's important to them. I think, for those of us that either have loved ones that are living in a long-term care setting or are advocating on their behalf, I think talking to residents and helping to raise their voices and experience is the very best thing we can do. This many of the state survey agencies, which are often housed in the departments of health, some will post them on their websites. If you are connected to a residential care community, they should be available through that community. You can They should be publicly available there. You can ask for them, or you can contact the state survey agency, and they should be able to tell you how to get it.
Well, Lori, thank you so much for sharing the contact information as well, and how people can follow up to learn more about all of the amazing work that Consumer Voice is doing. This has been a master class in rights, and I love what you shared right at the beginning, about how a rights-based approach to care and support is the best approach to support quality of life, right? And that thinking about those things as separate really doesn't make sense, that we need to consider all those together. I learned so much today. I know that all of our members did as well. So thank you, Lori, for joining us and for sharing this important information and all of your wisdom. And really appreciate your time and expertise.